isn't that the truth? Don't you want to go to somebody who's actually been on the journey and they know exactly how you feel? I didn't realize you had done it yourself. That is a
Yeah,
big,
this is largely hair transplanted, and I like to tell patients, I was the architect, but not the builder. I obviously worked with a close colleague, and but the design is important. And I had patients say, when you plan hair transplant, you're not just thinking in 3 dimensions, you're thinking 4 dimensions. And I was like, huh? And he said, well, you angle the hair length, width, depth, but also you're projecting over time. And I love that because I tell patients that exact thing. I say, you're 20, we're thinking 50, 60 years down the line. You're 40, we're thinking 50, 60 years ago. We want to plan long term and integrate the transplant in a successful way so that it looks natural over time. It's important to do everything you can to maintain your hair so there's no, so you can reduce and diminish ongoing loss. But planning so that this will look natural even in the face of ongoing hair loss and aging is key.